Once you've had a root canal, that may not be the last thing that tooth needs. Not a lot of people understand this, and there's a lot of misunderstanding and misinformation about what a root canal really is and what it does for you and your tooth and your body. Let's dig into this just a little bit. When a tooth needs a root canal, what that usually means is the nerve is affected in some way. So either the tooth has been broken down to that nerve level, or there's a deep cavity that's gone all the way to that nerve level. And the tooth is either dying or it's already dead. Once a tooth is dead, that's what creates that abscess that people complain about. The toothache, the swelling, all of that means that the tooth is dead, and bacteria have found that dead tissue, are starting to grow and build, and the infection is spreading all through that tooth and all through the jawbone surrounding it. That's what the pain comes from. So when a root canal is done, what happens is there's a main canal inside of each tooth. Some teeth have just one canal, some teeth have numerous canals, up to 4 or 5 canals in one tooth. That main canal is cleaned out and filled up. That's what a root canal is. Now, it's filled up with a plastic-like material that conforms to the inside of the tooth. The tooth is sterilized before that happens, and the idea is great. You get to keep the tooth in your mouth, you get to keep chewing with it. All of that is great. The trouble is there's more than just that main canal inside of the tooth. There are little side channels that go off of that main canal. They're called dentinal tubules in the dental world. I like to call them nutrient channels or feeder channels. It's the way that the tooth gets nutrients clear from the end of the root all the way up to the part of the tooth that you see, all the way out here. Now, a root canal procedure cannot clean all those little side channels. It's absolutely impossible to clean them or to fill them. So what happens is there's still dead tissue left out in those little side channels. And the problem is dead tissue, like we talked about, always attracts bacteria. So eventually bacteria are going to find the dead tissue that's been left in the tooth. It's inevitable. This requires your immune system to do a lot of work to help keep the bacteria tamped down so the infection doesn't spread. You might have something else that happens to your body that decreases your immune system's ability to fight what's going on in the tooth. This then allows the bacteria to spread, the infection to spread, and we find this on a cone beam CT scan. Sometimes we see it on a regular dental x-ray, but usually we can't. It's not detectable there. We have to do a cone beam CT scan and see this infection spreading into the bone and destroying the bone. Now, if it just stayed put, maybe you'd think that that's okay, but it doesn't just stay put. Every single time you chew, the tooth, in essence, is like a plunger pushing that infection through the bloodstream and through the rest of the body. So that infection doesn't just stay there. It's going to affect you. That's a problem. The bigger problem is that you don't even know it's happening, because when they did the root canal, they removed the nerve tissue in the tooth. They removed the sensory part of the tooth. So once this infection starts to spread, you don't have the warning system you did for the first time around. Now you don't know that it's spreading. And sometimes we see huge holes in the jawbone where this infection has spread, eaten away the bone. The patient actually has no idea about it. No idea here. They have all sorts of other health issues going on that we trace back to the tooth, but no idea that it's coming from their mouth. This is the problem with root canal. It's not that it was done poorly. In fact, there are a lot of fabulous root canals that I see that still have infection at the end of the root. So what do you do about it? This is always the next question. The trouble is the only way to get rid of the problem is to remove the problem, which is the tooth that has dead tissue in it. So the next step is to take out the tooth. And some people are confused at this point. They say, no, I had a root canal, my tooth's already gone. No. When you do a root canal, or when you have a root canal, they just remove the nerve in the center of the root. The tooth's still there. But in order to get rid of all of that dead tissue, the tooth has to be removed. So we remove the tooth and disinfect the bone, clean up the bone, get all the bacteria and infection out of the bone, and sometimes we have to regenerate the bone. We have to work to regenerate that. And then we can place a dental implant there. Ceramic dental implant is our choice. That's what you do about it. You can have the root canal retreated. We always give that option to our patients. When a retreat is done, what happens is they clean out that plastic-like material in the center of the root, freshen it all up again, and fill it up again. There's even a surgical root canal where they chop off the end of the root and fill it from the bottom end up. All of those can buy you some time. However, the problem is still the dead tissue inside of those little tiny tubules. A retreat and even a surgical root canal doesn't take care of that problem. Now, I've done thousands of root canals myself. In fact, There was a patient, Sherry, that came, and I had done her root canal. She was complaining about it, and she said, it just hasn't ever felt good ever since you did it. Now, I wouldn't have even done the root canal to begin with, but at the time I said, well, let's take an x-ray. This is what every dentist would do. Let's take an x-ray and see. I took a regular dental x-ray. It looked fine. It looked picture perfect, just like I would have been shown in school. But I had just gotten the CT machine, and I said, you know what? Let's go see what it looks like on that CT. So we took a CT, and I found literally a nickel-size area of jawbone that had been destroyed by spreading infection. No wonder it just had never felt right. So I gave her those two options. You can have it retreated or a surgical root canal done, or we can remove this and replace it with a dental implant. She wanted to remove and replace it. She said that infection is huge, and typically when I see something that size, that's what I'm going to recommend as well. It was huge. We took the tooth out, disinfected it really, really well, rebuilt the bone, and placed a dental implant. I saw her a couple of years later and was just chit-chatting with her, asking her. I knew she was a big tennis player and was asking her about her tennis and everything that she'd been doing. In fact, I think she came in that day in a tennis outfit. And she said, I have to tell you this. Ever since that tooth came out, she said, my endurance has increased so much. It's noticeable. She's like, my teammates have noticed this. My partners noticed this. Everybody says, what did you do? Because you can push through long matches now. You can hit harder. You can do a lot of things differently than you couldn't do before. And she said, all that I changed was that tooth. Isn't that amazing? Sometimes that low-grade infection in the body is enough that it taxes the body and doesn't allow it to do what it's really capable of. This is why I tell everybody about root canals. This is absolutely your choice. You can decide what to do with your tooth, but it's your tooth. So you should know enough to make an educated decision. You should know what's going on. There's no such thing as needing a root canal because you don't even need a tooth. We can remove the tooth and not even replace it, and you will be okay. You might not love it, but you'll be okay. We absolutely can replace it, however. There's no such thing as needing a root canal. You can do something that you feel better about and will help your body feel better by removing and replacing that tooth. This isn't an easy decision, I understand, but you need to know the choices that you have in front of you when making the decision. If you want to know more about this, please click and get our Root Canals Bad For You PDF. We're going to run through all this information. We're going to teach you everything you need to know to be able to make the best decision for you, for your tooth health, and for your overall health. That's what we're all about here.